From the News Channel 5 Network, this is Open Line.
Good evening, everyone. Happy Monday to you and welcome to Open Line. We are taking your calls tonight on a topic that I hope you really find beneficial. We are talking about hearing loss, and we have Dr. Jennifer McLaughlin with Elite Audiology here to talk about that. Thank you for being here.
I'm happy to be here. Thanks for having me.
Yeah, I wanted to let you know right off the bat, if you have a question for Dr. Jennifer, go ahead and give us a call. The number is at the bottom of the screen, 615-737+. We're taking all your calls tonight, so go ahead and ring us. In the meantime, I want to talk to Dr. McLaughlin about our hearing. It's something that most of us just take for granted, I would say, until we have a problem. So let's start with the basics. How do we hear?
Okay. Well, anything that makes a sound is going to also have sound waves associated with it. And the sound waves will go into the outer ear and then in through the ear canal. They hit the eardrum or the tympanic membrane. Then they go to these tiny little bones in the middle ear called the ossicles. And then they go to the inner ear, which is the end organ of hearing, and that's called the cochlea. It looks like a little snail shell. Now these little canals up here, those are the semicircular canals. Those control balance. But when the sound goes into the cochlea, it hits the little hair cells, and then it sends the signal up to the auditory nerve, and that sends a signal up to the brain.
And it all happens just like that, and that's why we take it for granted,
That's
I
right.
guess. Yeah. So I guess if I were to ask what goes wrong when we have hearing loss, there seems like there's a lot of different things that can go wrong.
Right. Many times the damage occurs in the inner ear. The little hair cells that I mentioned in the cochlea become damaged over time. They're supposed to move back and forth. They're in a kind of a fluid substance, and then eventually over time they'll lay down and they won't be able to come back up again. So then they're not able to send the signal through the nerve to the brain to let you know that some sound was there.
Sure. So you're missing out on part of life when you really can't hear.
Right. And that's 90% of hearing loss is in the inner ear. It's not treated medically with surgery or medication. So
when people come in to get an exam, what can they expect? What are you going to do?
First, we take a thorough case history, and we find out what kind of backgrounds, auditory environments they've been in. We think about their family history, if anyone in their family has a history of hearing problems, recreational and occupational noise exposure. And then I go over the tests before we actually do that. So at the end, people have a better understanding about the audiogram, which is the chart where we plot the hearing test results, and everything that goes along with that.
I remember as a kid back in school, we used to put on those headphones and they'd say, raise this hand, now raise that hand when you hear, you know, is that still the case?
That's pretty much it.
Really?
Except we're in a soundproof booth, and so it's a little bit more thorough than that, and we do a few more frequencies in the school screenings. But yes, you still raise your hand when you hear the tone, and that's pretty much the gold standard for hearing tests. So.
When should children start to be screened?
Well, we actually have newborn hearing screenings that everyone has done at birth. And so that's a different kind of test. It's called otoacoustic emissions. How that works is we present some tones into the ear. They're called distortion product tones typically. And a normal healthy ear will send some soft sounds back out. It's kind of like an echo coming from the inner ear. And that's how we test the newborns.
Well, that's interesting. Oh, I never knew that. My babies went through it, but I was like, how is this working? I don't really understand. Yeah, that's interesting. Okay, let's talk about signs of hearing loss at any age. Do they are they different among ages, or is it pretty consistent across the spectrum?
They are different at different ages.
Oh, okay.
With younger children, you would look for things along the lines of them not responding to their name, or a speech delay. A lot of times can be related to hearing loss. Now, at that age, typically it can be related to fluid or some ear infections, things like that. About 3 to 6 out of every 1,000 children are born with a hearing loss. So, and that would be, more permanent. And then as we get older, adults would notice things like turning up the radio or the TV, or having to ask loved ones to repeat themselves consistently, or having trouble when they don't have visual cues, when someone's in another room at home, things like that.
I've also noticed people will start looking at your mouth a lot. If they can't hear you, then they're trying to read your lips.
Yes, that's a very common coping mechanism, and it's actually a good thing. Your ears always will help you hear better. Even when people are fitted with hearing instruments, I encourage them to use their eyes to help them hear better.
Oh, okay. I never heard that before. That's interesting.
Yeah.
What is it about? Well, I mean, I guess it just comes back to getting older. So many people are resistant as they get older to admit that they're having trouble hearing. They will blame it on a whole host of things.
Yes.
How do you cope with, how do you, I guess, get over that with patients, or get them to get over that fact?
Right. Well, so many people will say, I can hear, but I can't understand. The reason for that is that typical hearing loss occurs more in the high pitches, and that's where a lot of the consonant sounds of speech are that give us our word understanding. About 80% of word understanding is in those high pitch ranges. They might have excellent hearing in the low pitches, so they can still hear. They understand that someone's speaking to them, but they don't understand the exact words, or they'll confuse hop from stop and pop. You know, those soft consonant sounds a lot of times are what's throwing them off. So
I guess by the time they come in to see you, they've kind of come to grips with, I need to do something.
Right.
What do you say to people who are living with someone who has hearing loss, and they're saying, come on now, you need to go see someone, and they just won't and won't and won't?
Right.
Can you give that person some tips?
Yeah, that's the hard part, is getting them through the door.
Yes.
First, I would say to just encourage them to have it checked out. It's just a test. We're just going to see what happens, and you'd be surprised. A lot of people that think that they have a significant problem, they don't.
Oh.
So we always encourage everyone over 50 to come in for a baseline test, just to see how everything's going, especially if they're having some of the concerns we mentioned, or their loved one notices some things going on there. But getting them through the door is the hard part. And if you go to someone you trust, that's part of the battle.
Yes.
I would always recommend going to a licensed audiologist. You can check that through the board of Tennessee, the Communication Disorders Board. Also someone who's either ASHA or AAA certified. That's the American Academy of Audiology and the Academy of Speech and Hearing Disorders. So
easy enough.
Yeah.
Now I should ask you, where is your office? Where is Elite Audiology?
Yes, I know, it's a tongue twister. We're located in Mount Juliet, Tennessee. It's exit 226. It's the Providence exit.
Very popular area.
It is. We're on the north side of the interstate, so the opposite side of the interstate of Providence. Less than a mile, about 3/4 of a mile on the right, in the Toddy building. We're up on the second floor.
Oh, fantastic. I know right where it is. I go by there just about every day. That's easy enough to find. All right, we're going to take a quick break. I'd love to hear some of your questions, so go ahead and give us a call. The number again, 615-737-PLUS, or that's 7587. Taking your questions and calls, and we're talking about hearing loss all hour long. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Hello everyone, I'm Ron Howes from the Storm 5 HD Weather Center. You're looking at radar now, showing any precipitation out there on this Monday night. And a look at temperatures across the southeastern U.S. as a relatively cool weather pattern continues. And here's a look at the current conditions now in Nashville. Our forecast for tonight, still a few stray showers, partly cloudy skies with some patchy fog forming. Overnight low of 54 degrees. Then on the 7-day forecast for tomorrow, a high of 70 with mostly cloudy skies. Chance for some more showers on Wednesday as another cold front moves through. That's going to give us a rather cool Thursday with a high of just 66, a low of 47, but warming back up into the 80s by the weekend. This has been a weather update from the Storm 5 HD Weather Center.
Attention homeowners, we're looking for 30 homeowners here in Nashville and throughout Middle Tennessee to participate in our home evaluation program. Here's what we want to do. We want to eliminate this problem, leaky, saggy gutters, by installing Leaf Guard, the only seamless one-piece system. Ask about our clog-free guarantee. You're going to love Leaf Guard. Listen to Alex.
Installation, they came quickly. They did the job and they were out within the day. And after the first rain, I was satisfied.
Thank you, Alex. Take a look at Leaf Guard. The water goes in, keeps out the leaves, pine needles, and other debris. Let me keep your gutters clean forever. Be one of 30 homeowners to save a lot of money. You're going to get 75% off installation. A $200 gift card as we compensate you for your time. Call us anywhere in Middle Tennessee right now and get dinner for two with your in-home estimate. 855-830-5535.
Greta is always biting her nails.
Drives me crazy.
First comes love, then comes marriage, then comes pet peeves.
This girl can never keep up with her phone.
He leaves the hair right in the sink.
Can these gadgets fix our favorite couple's annoying habits? Oh! Then when the baby comes for the American stars Matthew Rhys and Kerry Russell.
It's a girl, Rachel. It's a boy, Ray.
Plus the perfect marriage of bacon and burger. Next, Rachel.
Tomorrow morning at 9 on News Channel 5. You sock away your hard-earned money for the future. You trust professionals to take care of your life savings. Tonight, News Channel 5 investigates.
I felt betrayed.
A family that trusted expert advice.
I've lost everything.
That left them broke.
This guy took everything she had.
See how easily misplaced trust turned into financial ruin.
It's an awful feeling.
And think about your money. Is it safe? News Channel 5 investigates tonight at 10.
Welcome back to Open Line. I'm here with Dr. Jennifer McLaughlin from Elite Audiology. You're giving me some tongue twisters tonight. We got a lot of vowels in there. We're glad you're with us too. We're talking about hearing loss, how to combat it at any age. So if you have a question, please give us a call. 615-737+ is the number to call. We'll leave that up right there along the bottom of the screen. Hearing aids have come a long way.
Yes, they have.
Can you give us some examples of what's out there now?
Sure. Well, the most surprising thing that people will say to me is that they're shocked that we now have hearing instruments that can sync directly with your iPhone and your iPad. Yes.
Really?
It's actually your Bluetooth headset, and it looks like this. I don't know if they can see that.
Yeah, we've got it right there.
Okay.
Perfect.
So,
actually hold it down just a little bit right here.
Okay, like this. I'll even put it on the ear.
Yeah, that'll be good.
There we go. And that would normally go in the ear canal. But yes, the signal, actually there's a Bluetooth chip that's built into the actual hearing instrument, and it picks up the signals from the phone and iPad, so you can even stream music and videos and things like that, as well as phone calls.
Wow.
You can also use an app on your phone to make adjustments to the hearing instrument. You can increase and decrease the volume, change through the different program settings. It has a hearing aid finder. If you lose your hearing aids, it'll take you
That's huge.
to where it is.
Yes.
Yeah.
Okay, now that is very cool, and it's awesome, but it can also be very intimidating, especially for someone who may be older and they're just like, I don't want to deal with all this technology.
Yeah.
But when people come in and they get this hearing aid, do you help them figure all that out?
Of course, yes. I help everyone sync the instruments with their phone if they already have a smartphone. If they don't have a smartphone, I encourage them to get one, but if they don't have one, it's fine too. This technology is excellent. We have come so far as the signal processing has gotten so much faster, which means for the patient that the hearing instrument is better able to sort out speech from the background noise signal. So it can automatically adapt for the different environments that they're going into.
Now you mentioned you can stream music and get your phone calls through there. But it's still a hearing aid. I mean, it's still just to hear life around you.
Oh, yes. And people many times will come back in after even their first fitting and say, it sounds great, don't touch a thing. I've given your card to 3 people already. I mean, it's
That's
really,
the biggest compliment. That's great.
Yeah.
Now, this one's a little noticeable, not huge by any manner. I mean, we used to see, I remember my grandfather used to wear them. It was, a huge hearing aid.
Right.
These are small, but I know they come even tinier.
They do. We have smaller options, and this is not even the smallest option, but there's one that's called completely in the canal. And so it might be visible if someone were looking directly in your ear. There's one even smaller than this. It's called invisible in the canal, and it's all the way down in the.
Does it stay there permanently, or do you take it in and out every day?
We take these out at night. There are some that are able to stay in permanently, and They have kind of mixed results.
Okay.
Some people are not able to tolerate those staying in their ear for more than about 2 months is typically how people deal with that. But there is also surgery that could be done and different things like that. So,
what about care and cleaning of these hearing aids? What goes into that? What should people know?
Well, I always do a big overview of that also at the fitting appointment. But if anyone is having a problem with their hearing instruments and you know it's a good battery, because they are still battery operated, the next thing to check is the little wax guard. Almost every hearing instrument has a place where wax can get into it and cause it to malfunction or shut down. So checking the wax guard, knowing where the wax guard is, and that's helpful for loved ones also, because if you're helping someone who's maybe their manual dexterity is not as great.
Yes.
It's good for the loved one to come to the appointment so I can go over everything with them also as far as cleaning.
What are the complications that people usually run into? You know this far better than the questions I can imagine. So what are the problems that people run into? They come in and say, this isn't working.
Well, I mean, background noise is still, a concern. A lot of times what I've found is that some people will forget to switch it into their noise suppression program if they don't have, the more automatic features. And so I have to say, well, did you put it into your program too, or your restaurant setting? And they'll say, oh, I forgot I had that. So it takes a lot of practice to get into the habit of switching it for the different environments that you're in.
What about that squealing sometimes you hear from the hearing aids? What's that?
That's feedback. That's when the instrument, when sound or the volume is coming out of the speaker or the receiver and circling back into the microphone, that creates a feedback loop. And that's normal for it to happen when if the battery door is closed and it's sitting on a desk or something like that. It should not happen when it's in the person's ear.
Oh, okay.
A few things that can cause that are wax in the person's ear that can kind of stop the sound from going on its path. So that's one big thing to check. The instruments now have what's called automatic feedback suppression. So the instrument can detect when feedback is present and eliminate it. It generates a tone at the exact same pitch but the opposite sine wave pattern to kind of cancel it out.
Wow.
And so you don't have to worry about your grandparents' hearing instruments squealing and bothering the whole family.
Right.
So.
Well, it's not that stuff, but it startles you, and then you think, oh my gosh, what does that sound like in their ears? How terrible. How terrible.
And sometimes they can't even hear it.
Yeah. So maybe not as terrible as we think it is.
Right.
I want to talk about kids, and and even me. I go to the gym. I have my earbuds in. You see a lot of kids with their big, headphones on. Wow, I can only imagine the damage we're causing.
Right. There has been an increase in teen hearing loss in the past few years, and so we always encourage families, if anyone in the family can hear the child's earbuds and hear what they're listening to, they really need to turn it down. We can do a lot of damage. There's not a lot of limits built into the audio devices, so I recommend, like if you're at the gym, if there's one song you really like and you really want to turn it up, maybe for one song, but then try to turn it back down. You don't want it to be over 80 decibels for an extended period of time.
How can we gauge 80 decibels?
Well, you can get a sound level meter app on your phone if you want to be that scientific about it. But especially if it's hurting, or like if you can hear it in someone else's ear, that's way too loud.
Should you be able to hear conversation still, or?
Yes, that's a good rule. If you could still understand if someone else is talking to you, at least know they're talking and be able to take out your earbud. That's a good thing.
Is it bad that we're using earbuds so often? I mean, no matter the level, is that a hindrance to our hearing?
Well, there is a time and volume kind of trade-off. So the longer you're listening, the lower the volume should be.
Okay.
Or, vice versa. If you, like I said, if you wanted to listen to one loud song, just try not to make it, more than a few minutes, and try to turn it back down. Turn it to the left is what we say.
Is there a difference between the headphones and the earbuds, because the earbuds go in?
Right. Well, some people, it's kind of what works best for each person. Some people's ear canals can't hold the earbuds really well, and it is a good idea to get the noise canceling headphones, because then typically you don't have to turn it up as much. Because
makes sense.
If you're on the treadmill or something like that, you're going to cut out that noise, and then you don't have to turn up the volume of the music as much.
So with kids, you just the rule needs to be if we can hear the music, it's too loud.
Yes.
And you need to turn down. Or if you can't hear us having a conversation around you, it's too loud. You got to turn it down.
Right, and that's good for safety also. You know, they need to be able to.
What about for little ones? We're all going to be going out for summer activities, fireworks, sporting events, and then even adults going to concerts. Maybe you're taking your kids too, I don't know.
Right.
But when do we need to have the headphones on them to cancel out that noise?
Definitely if you're around fireworks. I know the last time I came to the fireworks downtown, it was extremely loud, and I think I'd forgotten my earplugs and I was like, you know, destroyed. So, but yes, anytime you're around fireworks or loud concerts, depending on, hopefully a child's concert wouldn't be that loud,
too
but
crazy,
like a teenager,
too rocking, yeah.
And you can get, if you're a musician, we have custom-made musicians plugs, or if you go to a lot of concerts, and they actually have a music filter kind of built in and a speech filter, so you can still understand the people with you, but you're just lowering that music level to a more comfortable and safe level.
Very good. Okay, we're going to take a quick pause from my questions and go to Sarah on the line. Sarah, thank you for being with us here on Open Line. What's your question tonight?
Hi, I really wanted to know, I've read recently that it's not good to clean your ears with a Q-tip. You know, once you get out of the shower, I feel like I always have some water in my ear, and so I want to use a Q-tip. But I heard that that's actually damaging your ear, so I wanted to know what you thought about it.
Sarah, I'm glad you asked that because I wanted to ask about cleaning your ears. And I mean, it can kind of get kind of gross, but it's something that we all do or think about doing. So how do you do this?
Well, that's a great question and one I hear a lot. Q-tips are great for cleaning the outside of your ears and maybe behind your ears and for removing makeup, but you do not want to put the Q-tip down in the ear canal. The reason is the ear canal was designed kind of like a conveyor belt. It will bring the wax out naturally. The same way, if you've had a child with tubes, the tube will come out of the ear canal naturally. A lot of times when we use a Q-tip, we're pushing the wax further down in. And I've looked in an ear canal before, and it looks like the shape of a Q-tip.
Really?
You can see, yes. So it is good to let warm water go down in the ear canal when you are in the shower or the bath. Warm, clean water from the tap is different than, you know, lake and swimming pool water. But that's a great thing to do to kind of help keep the wax from building up in there. Also, a hydrogen peroxide rinse, you know, once a month or something like that is a good thing.
How many drops of that hydrogen peroxide should you put in there?
I recommend to have, if you have a helper, that works well, or if you have a dropper, lay on your side, just kind of fill up the ear, let it sit for about 5 minutes.
Oh, that's a long time. Okay.
Yeah,
but
you can watch TV or do whatever, read something on your phone, and just let it sit for about 5 minutes and then roll over and do the other side. Yeah. And a lot of people only build up on one side, so.
Why is that?
I don't know why. I just, you know, it just happens. Sometimes I'll look in an ear, one's completely clear and the other one's not, so. And that's easy. I do wax removal in my office, so, and I actually like to do it. So
that's why you're an audiologist.
That is.
No, I'm the same thing. With my kids, I'm just like, oh, I gotta get that wax out. But so you're saying I can't do that anymore?
Well, and if you can see it and it's on the edge, you know, then you can kind of get it, but don't put the Q-tip down in there.
No. Okay.
And you can also, there have been cases where people have, I heard of someone who was traveling, and so they were in an unfamiliar bathroom, and they were doing that, and they bumped into the wall, and then the Q-tip can go in too far, and that's really...
It's painful.
Oh, excruciating, yes. And damaging to the inner ear.
Really?
Yeah.
How do you know if it's just you have a lot of wax buildup in there and that could be causing a problem? Is there a sign?
A lot of times people will hear their own voice a little bit more and hear yourself chew and things like that. You'll hear, you know, a little hollow or echoey sound with your own voice.
What about ear candling?
I don't recommend that.
Okay.
There have been cases where people have burned their eardrum with it, but I have I have seen a few patients who kind of swear by it and they love it, and that's their choice. I'm not.
You're not endorsing it, is what you're saying.
That's
you can say that. That's fine. That's fine. You're the audiologist. You can say exactly what you think.
Okay.
All right. On that note, we are going to take a quick break. If you have any questions like Sarah did, go ahead and give us a call. It's probably a question a lot of people are sitting at home wondering. So 737+ is the number to call. We are coming right back.
This week on Fishin' Affliction TV.
If this is a bass, this can't be
be a bass. Oh, it is a big one.
Join Team Fishing Affliction for some fun fishing action from the Lost episode series, On Fire in the Back of the Boat, Part 1.
That's a good one, boys and girls. Good job, Dan.
Your Fishing Affliction TV weekend begins Saturdays at 5 p.m. right here on News Channel 5 Plus, your home for
Fishing Affliction.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesty, above the fruited
Welcome back to Open Line. I just learned something new. May is hearing month. So if this is a great time to have your hearing checked, right?
Yes, we're offering
Good time as any.
free screenings in the month of May, since May is Better Hearing Month, and we're also offering $800 off a pair of hearing instruments in the top 3 tiers. That would include all of the iPhone and Apple compatible devices. So
okay, so we're going to get back to that. I will explain that one again in a little bit. I want to get to Walt. He's on the line. Walt, thank you for calling in today. What's your question?
Well, you covered part of it. I was diagnosed, I hate to say, 50 years ago with the hearing loss and the high frequency range, and also with the ringing, the loud ringing in my ear. Are they connected?
They are. Most likely they are. Typically we see that high frequency hearing loss, and tinnitus is the technical term for the ringing in the ears. And a lot of times once people are hearing the sounds in their environment at a more normal level, like with hearing instruments, they don't notice the tinnitus or ringing as much. There are a lot of other features built in to the hearing instruments that can help with that tinnitus. One is called a tinnitus sound generator, and the hearing instrument will actually produce either a white noise or like ocean waves, a relaxing sound to help distract your brain from the tinnitus or the ringing. We don't want to mask it or cover it up completely. We're just trying to retrain the brain to not focus on it as much.
Wow.
There are a few other things that can exacerbate the tinnitus or make it worse. That would include things like stress, or if you didn't get a good night of rest, alcohol, tobacco, sodium, different things like that. Anything that affects the blood flow to the ear can also kind of make that tinnitus
Because it can get to the point, this can be a very serious condition for some people, and even cause depression, I think, right?
Yes. We do an inventory, it's called the Tinnitus Handicap Inventory, to kind of measure where you are on the scale, whether the tinnitus is just a mild annoyance or if you really need some more serious help with it. And we always refer, to a specialist if they're in the moderate to severe range on that.
Walt, did we answer your question? Is there anything else we can help you with?
Well, this was many years ago, and I was informed basically that I would just have to live with it at that point, and I guess you get accustomed to it and you don't focus so much on the ringing until you mention it or you think about it, and then it really comes apparent to you. And I didn't know if it was any medications or anything that would help with the ringing, or they actually told me at one point that a hearing aid, and I know they've come a long way, that's 50 years ago, that they wouldn't help me any. And I was just wondering if they had advanced to the point that I could get a measure of relief from this.
Yes, I would definitely recommend getting your hearing checked again and doing a trial with hearing instruments. In the state of Tennessee, there's a 30-day trial period on any instruments that you buy. So you always have that trial period, but many times, even before people leave my office, they notice when they're wearing the hearing instruments that they don't hear the ringing as much. It's that fast of an effect. Also, there are some supplements that I recommend, including magnesium. 400 milligrams typically at bedtime is when people notice it more, when they're trying to go to sleep and relax. Everything's quiet in the house. L-theanine and GABA are the other two.
Okay, so magnesium, say those other two again? I'm not familiar with those.
L-theanine and GABA, G-A-B-A. It's short for something I can't pronounce. But, yeah.
But if you go to a health food store, they would know what you're talking about.
Yes.
What was that middle one again?
L-theanine, T-H-E-A-N-I-N-E, I believe.
All right, well, I hope that helps.
Very
Certainly,
much.
50 years is a long time to live with that, so maybe we can find you some relief. That would be nice.
Thank you very much. Enjoy your program.
All right, you have a good night. Good to hear from you. That is a long time, and I guess that's, you know, no matter the ailment, you got to just at least reach out and say, can there be some help?
Right. And it is difficult because hearing loss is such a gradual progression that people don't even notice it slipping away. But then when they do reach out for help and they come into our office and I explain everything and how it works and we let them try hearing instruments there in the office, people a lot of times are kind of sad that they waited so long, you know. So it's a great thing to just get it checked and, you know, see where everything stands.
And I know that the cost of a hearing aid can also be intimidating because we hear they cost so much money, and they do. I mean, they're expensive.
Right.
They're little pieces of machinery that are very expensive. Tell us about the different prices, and then also how insurance comes into play, maybe how Medicare comes into play.
Well, the prices range in our office anywhere from around $1,000 per ear up to around $3,500 per ear. So, and then insurance, Medicare doesn't pay anything on the hearing instruments, but will pay for the test as long as we have a referral from the primary care doctor. In May, we're doing the free screening, so that, you know,
takes care of that.
Take care of that part, right. So we also have 12 months no interest financing, so you can spread the payments out. That helps people a lot. We also work with charity programs, so people who truly cannot afford the hearing instruments can work through one of these charity programs, and we're able to provide low-cost hearing instruments for them.
What are those programs? What are some of the names that people could look up?
There's one locally called Hear Nashville, and a lot of times they will refer to a program that's called Hear Now. There's also one called Help America Hear, and it's a kind of extensive application process, but if you really need to hear better and you know, can't afford it, then that's a good alternative.
Okay, good enough. Yeah, good enough. Let's see, we've talked about headphones and earbuds. Today's hearing aids, I'm going through my list of everything I wanted to touch on. Hearing loss and memory loss. These can be very connected, and sometimes I think it can be hard to tell which is the culprit, isn't it?
There's been research from Johns Hopkins recently, well, in the past few years, and it does show a link between untreated hearing loss and an increase in early onset Alzheimer's and dementia. So it really is good for, you know, a number of reasons to get your hearing checked, because to try to prevent that cognitive decline. They've also done research at Johns Hopkins regarding hearing loss and a greater incidence of falling, or a greater falling risk.
Is that a balance thing?
Because that inner ear is related to not just the hearing but the balance. They feel like that's where the connection is.
Just another reason to come in and get that screening at least.
Right.
Yeah, and you said 50 is a good age to do that if you haven't been doing it all along.
Right, yes. 50 is a great age to start with that baseline hearing test, and you know, of course, certainly sooner if you're noticing trouble or your loved one is. Typically, it is the family member that notices it maybe before the individual themselves with hearing loss, but yeah.
And it doesn't have to be intimidating. It's pretty easy, it sounds like, to come into your office and talk to you. She's very friendly.
That's right, yes. It's not, you know, stuffy or pressured in our office. My receptionist, Susan, is great, and she helps make people feel at ease, and I just love helping people hear well. And so anytime I'm able to do that is a good day. Or when I can give them good news, like you don't have a hearing loss, that's a good day too.
That is,
So,
absolutely.
yeah.
Okay, we have Levon calling in. Levon, thank you for being with us tonight. What's your question?
I have a hearing loss of lately. I think I can't really tell which ear. But when you put that peroxide in your ear, that doesn't damage your eardrum or anything like that?
No. Levon, I'm going to put you on hold so we don't hear that feedback, okay?
Yeah.
But if we need to, we can get back to you. But go ahead.
Yeah.
Does that peroxide damage?
It does not. You don't want to do that every day, but the peroxide in the ear, occasionally, like I said, once a month, unless you have tubes in the ear or if you know you have a perforated eardrum, you do not want to put peroxide or any liquid in your ear in that case. But typically, you know, for most people, it's not going to damage. And that's what we used to do when I worked in the ear, nose, and throat office. So,
what about, I went to the doctor not too long ago and they said you have fluid in your ears and you just don't want to let it, and I could tell I was congested a little bit and it was kind of, you know, it had happened for a week and then it'd go away for a week and it happened, and they said you don't want to let that continue because it can cause hearing loss.
It can.
Yeah.
Typically in that situation, it's more, well, if it becomes an infection, that's typically the cause of the hearing loss. But if an infection went untreated for an extended period of time, that could cause permanent hearing loss. It's not as likely, but a lot of times when I have people with those symptoms and they're complaining of, you know, kind of that hollow feeling or
Yes.
it's not draining when it's related to sinus congestion, even just a saline nasal spray can kind of help open up those eustachian tubes to help let that fluid drain out.
Okay, that's a good tip. Yeah, I hate trying to have to take medicine for everything, so it's like, what can I do to get rid of this?
Right,
Yeah.
just a simple over-the-counter saline nasal spray is a good option in that situation.
All right, see, I got my own question answered tonight. Levon, I hope we helped you out. I'm going to check back on you here real quick. Levon, did we help you out? Do you have any other questions? Oh, I think we must have helped her out, so that was good. Okay. There was another question I was just thinking about I wanted to ask you. Oh, so many, I have little ones, and a lot of my friends have little ones too, and they're talking about getting tubes in their ears. Why is that helpful? What would be the pros? What would be the cons?
Well, that's a good thing to discuss with your child's pediatrician and ear, nose, and throat specialist. But typically, I think they say if they've had like 6 ear infections in the year, that's when it's time to, you know, kind of start looking at tubes. The pros are that it's going to allow that fluid to drain out of the middle ear more quickly. So, because a lot of times in little ones, their eustachian tubes aren't angled down as much as they are once we're adults. So because their eustachian tubes are more horizontal, they're not, you know, able to drain the fluid out. Plus, with all the germs, it just, you know, tends sometimes to stay in there a little bit longer. So especially if your child is having maybe a speech delay or speech and language problems because of the fluid being in there so long, it's probably, you know, a good idea to at least talk about it with the pediatrician and the ear, nose, and throat specialist.
Okay, very good. All right, I think we're going to take another quick break, and remember, if you have any questions that you want to ask tonight, this is your chance to do so for free, I might add, to an audiologist here in town. So when we come back, more of your questions, more of my questions, we'll get them all answered. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Hello, everyone. I'm Ron Howes from the Storm 5 HD Weather Center. You're looking at radar now, showing any precipitation out there on this Monday night. And a look at temperatures across the southeastern U.S. as a relatively cool weather pattern continues. And here's a look at the current conditions now in Nashville. Our forecast for tonight, still a few stray showers, partly cloudy skies with some patchy fog forming. Overnight low of 54 degrees. Then on the 7-day forecast for tomorrow, a high of 70 with mostly cloudy skies. Chance for some more showers on Wednesday as another cold front moves through. That's going to give us a rather cool Thursday with a high of just 66, a low of 47, but warming back up into the 80s by the weekend. This has been a weather update from the Storm 5 HD Weather Center.
through Franklin Kia this month, put no money down, pay $199 a month on a brand new Kia Soul that includes your tax, your tag, all the fees, and you're out the door. That's your choice, Kia Forte or Kia Soul. No money down, just $199 a month. That includes your tax, your tag, your title, and all the fees. And best of all, it's not a lease. You own it.
That's awesome.
That's right, you heard it. No money down, $199 a month on a 2016 Forte or Soul. Franklin Kia, keeping it awesome.
Team in training. Train to save lives. Marathons, half marathons, triathlons, cycling. Get it done. Team in training. Join. Get in shape. Raise money. Save lives.
Sometimes the worst storms try to hide. They line up in the radar sweep, kind of like someone hiding behind a tree. That's why we don't rely on just one radar. We use 5 live radars, 5 times more data to see every storm from every angle. And that's the safest you can be in a storm, no matter how you look at it. Safety to the power of 5.
Welcome back to Open Line. Thank you for being with us here tonight. We're talking to Dr. Jennifer McLaughlin with the Elite Audiology in Mount Juliet, and we're talking about hearing loss and everything that goes along with it. So if you have a question, go ahead and give us a call. 615-737-PLUS is the number to call. Lines are open, so feel free to call right now. We'll get to your question tonight. When we left before the break, we were talking about tubes for kids and when you should get them, when you should not get them. Let's also talk about swimmer's ear, because swimming season is coming up, and a lot of kids are going to be in the water all the time. What is swimmer's ear? How do you get it? How do you get rid of it?
Right. Swimmer's ear is an infection in the outer ear, and it's just when, you know, some of that germy water gets in there and kind of settles in. It's very painful. I've had it before. It's not very fun. If you're concerned about that, or if you tend to get that a lot, we do have custom earplugs for swimmers and for the little ones who are having the tubes placed in their ears. We make those in the office. We make an impression of the ear, and that allows, you know, the kiddos and anyone who tends to get swimmer's ear to still enjoy the water without having to worry about, you know, dreading, hoping that they don't get the swimmer's ear. So.
How expensive is it to get a custom earplug?
Typically they're about $100 for the pair. And that's about, you know, if you were looking at a custom like musician's plug or something like that, it's going to be a little bit more, closer to $200. But yeah, for the swim plugs, yeah, about $100.
Is it a wise investment if you have a kid like on swim team who is constantly in the water?
Sure, especially if they, you know, tend to get swimmer's ear. You know, you can also use those drops that help dry up, you know, the water once they get out, and that tends to help also.
All right, you showed us a few hearing aids. Let's look at a little more. You brought a few other props with you. What do you have?
Yeah, we have some different styles and options. That was the smallest, or the smaller of the in-the-ear version. We also have, this is called a microphone in helix. This microphone actually tucks up into the top part of the ear. That's really good for golfers because it eliminates a lot of wind noise.
Oh.
We have a larger version of this, which just has a larger battery. So your battery is going to last on this larger one closer to 10 days, whereas this one it's more like 5 to 7 days with the smaller battery.
Now, are those ones you can recharge, or are you buying new batteries all the time?
We do have rechargeable battery options manufacturers that we work with, but with all of our hearing instruments in the top 3 tiers, we provide the batteries for 5 years.
Oh, that's nice.
So we're more about service in our office than just selling you a pair of instruments and saying see you later.
Yeah.
We provide quarterly office visits. Everyone comes in every 3 to 6 months, picks up their batteries. We do any adjustments, clean and check the hearing instruments, and that's all included in the price of the hearing instrument.
That's wonderful.
Yeah, so you're not having to run to the store and buy batteries all the time. We even mail batteries if people have, if someone happens to move away or it's inconvenient for them to come to the office, we'll ship your batteries to you.
All right, so this was the little bit bigger one, the one you talked about earlier that connects to your iPhone or iPad and all that jazz.
Yes, we even have instruments this size that can connect with your iPhone, also an iPad or iPod Touch, and that's the generation 5 of the iPhone or later. Anything with that smaller lightning port can sync with something this size or larger. So this is the larger one. A lot of people would say, why would I want that larger one when I could have maybe the smaller one? People with manual dexterity problems who might not be able to handle this, and this is also going to require a smaller battery, which typically has to be changed every 4 days or so in the smaller model. These typically have a larger battery. Also, we can get more power in the larger instruments because with the smaller devices, we're not always able to get a speaker in there that's big enough to get enough power in there. And
you look at every individual and fit them for different things. You keep different things in mind.
Right. We have a very individualized approach. It's definitely not one size fits all. We fit hearing instruments based on each person's hearing loss, on their lifestyle, and on their budget. I'm not, going to recommend the top of the line hearing instruments for someone who's in a nursing home, so it's a very individualized approach for each patient.
Good enough. Let's talk to Betty. She's on the line calling in with a question. Betty, thank you for being with us.
Yes, I wanted to ask her about, I had an ear that got stopped up. When I shampooed my hair, it felt like the water was still in there and I couldn't get it out. That went on for a couple of days, and then I started having a roaring in there. When I did go to the doctor, she said I needed to have my ears cleaned out. And when they started that process, I started getting real dizzy. I told them, they said, well, that happens sometimes. And then I got awfully nauseated, and then started throwing up.
Well, this sounds terrible.
Yeah.
Yes, that was a bad experience, but it did take care of my ear, but I wouldn't want to go through that again.
Is that typical, what Betty was experiencing?
It is. If the water is a certain temperature and if your head is at a certain angle, it can kind of incite that vestibular response that does cause dizziness and nausea. And we actually, in a lot of the vestibular testing that I used to do at the ear, nose, and throat office, that was a very typical reaction, and we were looking for that dizziness to try to figure out what was causing each person's dizziness. But it's also very common to, when your ear is stopped up with wax, for it to get worse before it gets better. So if you get some water in there with the wax and it gets kind of maybe behind the wax and kind of gets trapped in that ear canal, it can get worse before it gets better, and you might have to get the wax taken out in order to let all the water back out.
So what can she do differently so she doesn't have to go through this again?
I would recommend just maintenance on the ear cleaning. If you don't normally get your ears wet in the shower, then I would probably do the hydrogen peroxide. You could maybe mix it with a warm water, 50% solution of warm water and hydrogen peroxide, and pour it in your ear, once a month or so to kind of keep the wax from building up. That's good for anyone who doesn't typically or doesn't like to get their ears wet in the shower. But normally just pulling back on that ear, letting the warm, clean water go down in the ear canal is a good way to help keep the wax from building up.
All right, Betty, I hope that helps. I don't want you to have to go through that again.
Oh, thank you.
You have a good night. All right, we also have Alan on the line. Alan, good evening to you. What's your question?
Yeah, I think the doctor mentioned something about for kids that there's some drops that you can put in there to keep the water out. What was that?
I can't think of the brand name at the moment, but I think there are some drops that are like ear drying drops.
I think it's over the counter, isn't it? It's like swimmer's ear. I mean, I think it may be that.
Right,
swimmer's
yeah.
ear.
It's just an over the counter. They also make, if you don't want the custom plugs, the little wax plugs that you can put in your kids' ears to kind of help keep the wax from getting in there. As the pharmacist, because I can't remember the name of the drops for
but it would just be
drying.
a drying drop for your ear. Okay.
Another question.
Go ahead.
If someone comes to your office and they need their ears cleaned out, how do you do this?
It depends on the type of wax. So I'll look in the person's ear, and if it depends on if the wax if it looks soft or if it looks more hard and impacted. There's lots of different tools I can use. I'm very gentle. I don't like for people, and I have time. That's part of the reason I went into private practice, is so I wouldn't have to be rushed when I was working with people. So I have lots of different tools I can use to try to, coax it on out gently. I also have irrigation and suction, which I don't lean people back when I do the irrigation so that we're not, starting that vestibular response to make people dizzy. But it, puts water in the ear and then suctions it back out, and we just try to loosen it up, and I'll switch back and forth between the, the tools and the water and irrigation and suction until we get everything out.
It makes sense.
Very much.
Yeah, you're welcome.
Right. Thank you for calling in. All right, let's talk to Lucy real quick. Lucy, what's your question tonight?
Yeah, I just tuned in late. If you've already answered this is okay, but you don't have to go over it again. But have you covered strep bacteria and ear infections in the young and old related to your teeth?
No, we have not, Lucy. You always call in with deep questions. We have not gotten there yet, Lucy. Thank you.
All right, thank you. Bye-bye.
All right, have a good one.
You too.
Any thoughts on that?
That would probably be a question for your ear, nose, and throat specialist or your primary care doctor.
Okay.
I'm not a medical doctor. I'm just a doctor of audiology.
Don't say just. You are a doctor of audiology.
Yeah.
Yes.
But strep is kind of out of my realm of expertise. So,
okay.
Yeah.
Good enough. Good enough. And we should say you're a homegrown gal.
You're right. Yes, I'm from right here in Nashville, born and raised. I just went away 8 years for school, and then I came back.
And we got to talk about some of your training, because I read this and it just stuck out to me. You were on a pre-cochlear implant team, and I think that we've all seen those videos when someone's getting fit for those cochlear implants and they hear for the first time, and it always makes me cry, especially when as a child hearing their mom's voice.
Yes.
It wrecks me.
Yes, me too. I cry every time. But yes, when I was at Children's Hospital in Birmingham, Alabama, I was on the pre-cochlear implant team, and so we did a lot of the pre-surgery assessment to determine if someone is a good candidate for a cochlear implant, and it was a very rewarding part of my training.
Oh, I would say that had to be, and those implants have come so far. I mean, it's just amazing what we can do now.
It is, and I always check people's hearing test results to see, and I've referred a few of my patients for cochlear implants, and they've had successful surgeries, and they're doing great. And those videos make me cry every time too. I don't usually get that response with hearing aids, but I did one time with a high school student who had been kind of diagnosed with a learning disability, and then come to find out it was really just a hearing loss the whole time. So.
And they were already in high school by the time they found out.
Yes.
Think how much time and how much had been missed.
I know.
Just from not being able to hear.
Yeah.
If you have a child and you think something's going on, what should a parent do?
Definitely if they seem to be having trouble in school, or not understanding their teachers, or not understanding you, turning up their TV and radio too loud, those are all good signs and signals that, might just get the hearing checked and make sure that that's not the problem.
Okay. Okay. And then, of course, let's touch on those real quickly, the signs for maybe an older adult that they're starting to really have significant hearing loss.
Right. Asking people for repetition, especially, female voices are typically the first that are more difficult to hear. Turning up the TV too loud, not being able to understand in a restaurant or background noise situation is a very common complaint, because a lot of times, like I said, when you have that good low frequency hearing, that's where the background noise sounds are, in those low pitches. But if you're still missing those consonant sounds of speech in the high frequency range, a lot of times that's where people are starting to have more trouble. And then also without the visual cues. So a good communication tip for a loved one would be, if you're talking to someone, try to place your face where there's light shining on it. Don't talk with your hands over your mouth. Get someone's attention before you start talking. Right, and go into the same room as them so that they can see you while you're trying to have a conversation with them.
Okay, with that, we're going to take a quick break. We'll be right back.
We're growing here at Creekside at Three Rivers. Coming in early 2016, we'll be offering a new senior assisted living option. Our new Creekside Villas will feature memory care in a unique luxury setting. We're accepting deposits now, and if you're among the first to move in, you'll receive reduced rent for the first 6 months. For more information about all of our senior assisted living options, visit us today at creeksideassistedliving.com.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner. America always stand. History will write the story. America will always stand.
If you would like to get a hold of Dr. Jennifer McLaughlin with Elite Audiology, I tried to nail it that time. Here is how to do it. EliteAud.com or 615-758-7118. Her practice is in Mount Juliet, and you have a special this month.
We do. For Better Hearing Month, it's $800 off a pair.
That's amazing.
It is. Of the top 3 tiers, like I said, those are all the ones that will sync directly with your Apple products and the Samsung Galaxy phones. I forgot to mention that.
Very nice. And she'll show you how to do all of it.
That's right. We'll see.
Thank you so much for your knowledge today and sharing it with us. I've learned a lot, and I hope you have as well. Have a fantastic evening.